Jason, why don't you discuss the case you showed me 2 days ago that you did?
Well, a case I did a few days ago was a woman, 65-year-old woman who I had met actually a couple years before. She had a pretty severe scoliosis, which is just a bad curvature of the spine, wasn't able to stand upright, was pretty miserable, unfortunately, and debilitated by this condition. She was found to have severe osteoporosis with a DEXA scan, our bone mineral density of -3. So it took a lot of stuff before surgery to kind of get her ready for surgery. So we sent her to our bone health specialist. We got her on one of these anabolic or bone building medications. We actually waited, I think, almost 9 months for her to be on that medication. And then we performed surgery. And so far so good. Surgery was like a few days ago. But you could tell in surgery kind of how much these medications help by the strength of the bone. Like Ben was saying too, kind of like if you're putting a screw into a really good piece of wood, that screw feels really solid. If you put that screw into a softer wood piece of wood, it doesn't feel so solid. And these medications really help with that process.
And Dr. Savage, thank you for sharing that case. That's just a miracle that we can make these things happen for people. What will her picture look like after surgery in terms of having to stay on her osteoporosis medication?
Yeah, that's a great question. And so it's not just before surgery that's important, it's after surgery as well. And Paul could probably talk about this a little bit better than I can. But in general, these anabolic agents are given for about 2 years. So if we treat them for 6 to 9 months before surgery, they're going to be on it for 12 to 15 months after surgery.
Yeah.